This is the sound of whooping cough, a bacterial infection that can be fatal. Some children who catch it develop deadly complications. The disease kills over 200,000 babies in the world every year, and it's on the rise in Europe. We're seeing more and more new cases of whooping cough. Quite recently, there's been a huge increase in many European countries where the disease is present. Immunisation is now standard practice, but the problem is that current vaccines have no effect on babies younger than 2 months old. But it's precisely during those first few weeks of life that whooping cough is the most severe, with the highest risk of mortality. A consortium based at the Institut Pasteur in Lille may have found the solution. It's called Child Innovac.
What's new about our approach is actually a vaccine that can be given right at birth, if possible, or at least within the first week of life, and that can protect infants from the time they're born up until their first classic vaccinations. We took the bacteria that causes whooping cough and genetically modified its genome. We targeted a certain number of genes we knew, and by modifying those genes, we were able to develop a bacteria that no longer causes any problems, but instead triggers a healthy immune response and provides protection.
This technique represents a radical departure from current vaccines, which only contain inert pieces of the bacteria.
It's the whole bacteria, so the immune system encounters the entire bacteria. The other important element is that our vaccine is administered nasally instead of via injection, like other vaccines.
The result is a vaccine which reproduces the natural conditions of infection as closely as possible. Conditions that a baby's immune system can respond to, even at birth. Clinical tests are still at an early stage, but results so far have gone well. And there was an unexpected bonus when the team looked for possible negative effects of the vaccine on other illnesses such as flu.
The nice surprise was that not only were there no ill effects, on the contrary, it also protected against influenza-induced pneumonia. So we went on to test it with other models of infection and also non-infectious models such as asthma. And we realized that our vaccine had an anti-inflammatory effect on the respiratory system, making its field of application considerably larger than the whooping cough prevention it was initially designed for.